Hi, Dr. Paul. Today's question is one that many parents are probably anxious to hear about. Can you tell us about the revised COVID-19 school and childcare screening? What's changed and how is it going to change things for schools and for parents?
Sure. First of all, we now know that there are four symptoms that really go with COVID, and they are really fever, cough, shortness of breath, and losing your sense of smell and taste. So those are the four, what I call them, COVID typical symptoms. So if your child has any one of those, the child needs to stay home and be evaluated for COVID, getting testing and getting a medical evaluation. So what's different now is that we have other symptoms that are not necessarily highly associated with COVID. So for example, sore throat, stuffy nose or runny nose, headache, nausea, vomiting, or gastro symptoms, or malaise and fatigue. These symptoms now are less likely to be associated with COVID and due to other things. So what's changed, if your child has any one of those symptoms, simply the child needs to stay home for about 24 hours until feeling better, and then can go back to school without the need of a test, COVID test, nor a medical note. So that's the difference between the two. However, if your child has more than two of those symptoms, which are not typical symptoms of COVID, but if there's two or more, then we will consider the child as potentially having COVID, and then we'd have to revert back to staying home until we rule out COVID by a COVID test or medical evaluation.
So, Dr. Paul, do you expect that these changes to the screening will have an impact on schools and school-age children as a whole?
Yes, I do. In fact, this will make life a bit easier for everybody. Currently, with the older guidelines, any symptom required the child to stay home and was considered a COVID symptom until proven otherwise. Right now, it will make it easier because it's very common for a child to have a runny nose or a sore throat. And we know that the vast majority of children who have those symptoms do not have COVID. So it'll make life easier for parents and kids and avoid any unnecessary testing.
Fantastic. Thank you.
Thanks, and we look forward to answering more of your questions. See you next time.